Let's go across now to guests who are joining us on the program. We have with us Dr. Muzaffar Lakrawala, advisor BMC for COVID jumbo facilities. He's also director of surgery at Sir HN Reliance Foundation Hospital in Mumbai. We're also being joined by Dr. Suresh Kumar, MD, LNJP Hospital, and a member of Delhi's COVID task force. It's a pleasure speaking with you again, Dr. Kumar and Dr. Lakrawala. Welcome to the show. A quick question to you first, since you're obviously seeing a large cross-section of patients at the BMC's COVID jumbo facilities. What sort of hospitalizations are you seeing there? What are these cases, and how do we explain this uptick in hospitalization that we're now seeing in these numbers?
See, the numbers of the numbers of COVID cases have gone up, so there is bound to be hospitalization. On one hand, there is asymptomatic hospitalization, basically for isolation for slum dwellers who cannot isolate themselves. The next lot of people are the people who are affected with COVID and are, like Mumbai has always said, that we still have the Delta variant around besides the Omicron. So not only are the people who are above 60, who are immunocompromised and who are having problems getting that need for hospitalization where the oxygen saturations are dropping, but also people who with the Omicron variant, what we've also seen is those people above 60 and people who've got comorbidities like diabetes, hypertension, various other things, they are needing care because their comorbidities are worsening because of the COVID.
Right, fair enough. But Dr. Lakrawala, in terms of absolute numbers, is Mumbai now seeing a steady decrease in the last few days? Would you say that the numbers bear out the hypothesis that Mumbai has peaked and now cases are on the decline?
I think we are seeing a downward trend, and that's very encouraging. But I would not say that we've passed the peak or anything of that sort. I think if we continue to see this kind of downward trend for the next week or so, then I would say that we passed the peak.
All right. Well, interesting. You're being careful, but of course we've heard from other experts also who are already sort of announcing that, you know, the peak is over and done with. In fact, in Delhi particularly, we've heard from the state health minister pretty much announcing that. Is that an assessment that you agree with, Dr. Suresh Kumar? Has Delhi in fact seen its peak and our cases now coming down steadily and regularly? And in that case, what would explain this slight increase in hospitalizations? What are the kind of cases that are being seen?
You see, ma'am, there is only marginal increase. If you see from 2.8 to 3.1, 1 day difference only. And we have seen that large number of these patients are those who are having chronic illnesses, like tuberculosis, dialysis patient. And we have many patients who are now infected, pregnant mothers who are expected delivery. And we have right now 10 to 15 admission per day because of pregnancy. So they are not there in the hospital because of the primary COVID complications. They are just there because of their delivery. So we have the cesarean section, you have the normal delivery, and they are accidentally found to be corona positive. So like we have the more hospitalization.
So then, Dr. Kumar, this is something we're hearing even in terms of the number of deaths or the death cases. When we hear the Delhi Health Bulletin and the breakup of those who've died, we're hearing explanations that these are people who died with COVID, but with other health complications being primary. Would you say that that is necessarily true of most COVID deaths that are being reported in this third wave?
You see, we normally have more deaths in the month of January. We have more strokes, more cardiac failure, more heart attacks. We have the more and more patients because of the pneumonia. You see the temperature in Delhi is less than 15, and you have the elderly population, children coming to the hospital with the pneumonia, even without COVID. So these patients who are having comorbidity or have a chronic illness, they are there in the deaths which we have seen in last 2-3 weeks. But large number of these deaths are maybe because of the cancers, because of the COPD, because of the dialysis patient, liver failure patients. So like that, we have many. The primary only COVID without any disease, are very, very rare.
Okay. I think that's a very important point you're making. Dr. Lakrawala, is that something you would agree with, that, in terms of deaths that are being seen in this wave, COVID is almost incidental rather than the primary cause of mortality?
One thing we've noticed is that majority of those people who've died due to COVID alone are those people who are unvaccinated, people who've not received both doses of their vaccination, or people who have got a single dose of vaccination. So they are the ones who are most susceptible to corona. But also, people who got double vaccinated are people who are much above, who are immunocompromised, who've got comorbidities that have got worsened because of COVID. So COVID definitely does play a certain role in worsening of comorbidities. That's what we've seen with the Omicron variant.
All right. Thank you both very much indeed for joining us on this quick discussion.